As a parent, personally, I think that's a little excessive.
I don't like it. They take their only private place in the school that they can do their business.
Some parents in Florence, Alabama say they're outraged over school's decision to remove bathroom stall doors to fight vaping. School officials say students have been sneaking in and vaping. About 2 weeks ago, one student was found passed out. The doors were only removed from some of the stalls in the boys' bathroom. The principal says it could be temporary as they try to come up with other solutions. Parents argue that a better option would be to have an adult in the hallway or in the bathroom. Senator Dick Durbin of Illinois is urging the FDA to take immediate action as the number of vaping-related lung illnesses continues to rise, especially among young adults. Moments ago, he held a news conference to discuss the epidemic.
Previously healthy young people are getting seriously ill because our Food and Drug Administration in Washington has failed to protect them from the dangers of e-cigarettes. Can one really say with a straight face that e-cigarette flavors like gummy bear, citrusing, surf cake, and unicorn milk were meant for 50-year-old chain smokers to stop smoking cigarettes? Young, healthy people in Illinois and across the nation are getting sick and dying. The acting Food and Drug Administration commissioner has the power to do something. It's time that he either does something or resigns.
This comes as the FDA has issued a warning letter to the e-cigarette maker Juul about its marketing tactics. The CDC is urging Americans to hold off on vaping for now as it investigates 450 cases of severe lung illnesses and 5 deaths possibly tied to it. Most of the cases involve people between the ages of 18 and 25 years old, reportedly all used some sort of e-cigarette. Joining me now to talk about this is family and emergency medicine doctor Janette Nesheiwat. Thank you so much for joining us, doctor.
My pleasure.
You know, doctors aren't exactly sure exactly what's causing the lung illness. I think it's a toxic combination, if I'm not mistaken. One pediatrician who was at that news conference with Senator Durbin said that the vaping effects in the lungs are more than traditional cigarettes. I want to take a listen and I want to get your reaction. So listen here, please.
Many youth inaccurately believe that when they use e-cigarettes, they are simply inhaling a harmless water vapor. Unfortunately, this couldn't be further from the truth. What they're inhaling is a chemical-filled aerosol. The particles in this aerosol are so fine, the toxic chemicals that are being heated and inhaled while vaping can go deeper into the lungs than traditional combustible cigarettes.
All right, doctor, I'm curious to hear about your opinion. Are federal health officials doing enough to keep people safe, especially when we hear about what's being inhaled?
So we definitely need to do more. Now, normally vaping has been successfully used to help traditional cigarette smokers quit smoking. But right now, because of all this disease in the lungs that we're finding, because of all these young teenagers and kids who are being hospitalized for severe lung damage, we have to put a halt on it because we need to determine and investigate what is it exactly that's causing this sudden uprise of severe lung damage. It's just like, you know, when we have a food recall with, you know, salmonella, with romaine lettuce or anything like that, we have to do an investigation and figure out what's exactly is causing it, which is why the CDC and the FDA are saying stop all vaping until we can figure out exactly what it is, because we don't know exactly what it is. It could be a mixture of bootleg marijuana or counterfeit THC products that are contaminated with other drugs. It's been linked to counterfeit THC. It's been linked to vitamin E. It's been linked to chemical artificial flavorings, potentially causing this acute respiratory distress that we're seeing in these young kids and young teenagers. So we need further investigation. And until then, it could potentially be harming anyone. And that's why we don't want anyone else to end up in the hospital, in the ICU, or on a ventilator. But we definitely need to do more. We need to protect the youth, our young children, our kids, but also even adults need to be careful where they're getting their products from because of this uprise in severe lung damage that we're seeing.
You talked about this impacting young kids. You talked about it impacting young teenagers. Are we seeing an uptick in that demographic between 18 to 25 because of the flavors and the marketing? I mean, who's to blame here?
Absolutely. So what's happening is, for example, there are some vape devices, they're tiny. They're maybe 3 inches long. They're discreet. You can easily hide them. You can charge them up in your laptop where it looks like a USB port. And the flavors are appealing to kids. Cotton candy, fruit punch, mango, watermelon. These are all, flavors that children love. And so they're going to be attracted to it. There was marketing online, on social media by different vaping companies, which targeted children. They targeted everyone, but children were involved and were seeing these advertisements. So I think there's so much we need to do. We need to get rid of the advertisements online and on TV. We got to get rid of the commercials that are promoting these vaping products that kids are seeing, because we don't want to see this epidemic rise. We already have millions of teenagers and young kids who are vaping. And I myself, personally, I have had patients come in with severe chest pain. Their lungs are collapsed. I've had to cut open the chest of patients and insert a chest tube so that they don't die. I've got young teenagers come in. They sound like they have severe asthma when they don't. It was just from vaping. They're having cough and chest pain and shortness of breath. So we definitely need to have more education. I think education is the key to prevention, tackling these kids at a very young age, teaching them that the dangers of smoking and vaping is very harmful to them, because their lungs are still developing, their lungs are still growing up until about age 20, 21. In addition, the nicotine is highly addictive to these young kids, and if they get hooked, as a teenager, as a young child, they're going to be hooked potentially for life. And about half of these kids who use e-cigarettes, they're going to go on to be regular cigarette smokers within 6 months. And smoking causes more deaths than drugs, than guns, than alcohol, than car accidents, and HIV combined. So we definitely need to take quick action to protect our youth, protect our children, and to protect others who may not realize what they're inhaling. Even if you buy a cartridge of vape juice from a well-known, well-to-do store, it potentially could still be contaminated. So just let's wait till this investigation is complete until we can get some further answers so nobody else gets harmed.
All right, Dr. Janette Nesheiwat, thank you so much. Hugely useful information.
Thank you.